WashU Orthopedics is a global leader in the field of hip and knee replacement. We have a team of surgeons that are technically outstanding, they're dedicated to taking excellent care of patients, and they're invested in performing groundbreaking research for the future.
We're not just looking for a reason to add technology to our practice. The technology has to meet a need. So in the past, our need for technology was how do we reduce dislocation or instability in hip replacement? How do we improve our balancing on knee replacement? And robotics met that need.
The robot has been in use for about 10 years, so people have been using this for a while. This isn't brand new technology. When a patient's more reserved about the robot, they maybe just need to hear more about it.
I tell patients that with robotic joint replacement, I am still performing the whole procedure. I'm just using the robot as a surgical tool to execute the procedure in a very accurate and precise way. I think there are three main benefits to robotic joint replacement. Number one, the surgical planning is very, very enhanced. We're able to take a 3D model of the patient's unique anatomy and plan our hip replacement before we ever even enter the operating room. Number two, the alignment of the joint is optimized. We can place our components in a very exact and personalized position that best matches that patient so they can have the best recovery and the best outcome possible. And number three, the precision and accuracy with which we can place our components in this robotic hip or knee replacement is absolutely unparalleled.
Personally, if I were having joint replacement, I would want it to be with a robot because it requires extra work up front for the surgeon to make sure that the components are well positioned for my unique anatomy, and it allows for a reproducible outcome with the robotic platform.
So I think when patients get a joint replacement here at WashU Orthopedics, they can expect to have their pain eliminated, their function restored, and their quality of life increased.
I think surgery does come with risk, but most patients do extremely well after hip or knee replacement and are able to do the things they enjoy. So go hiking again, go to Disneyland with their grandkids, even just go to the grocery store, walk around, keep up with their significant other on their walks in the evening. Whatever it is that's important to the patient, that's usually what our goal is to get them back to.